Welcome to our report card on performance indicators. The jurisdiction we have chosen is the Canadian versus Health Services, and this PowerPoint is presented by Megan Boucher, Laura Johnson, Melanie Kibsey, Karen Totten, and myself, Jill Woods. Enjoy! The Canadian Forces Health Services is Canada's 14th health jurisdiction. The role of the CFHS is to provide comprehensive health services to Canadian Armed Forces personnel at home and abroad by both military and civilian healthcare professionals. 5 quality and performance indicators were chosen to evaluate the jurisdiction: accessibility, health promotion, health outcomes, spending, and client experience. Accessibility to healthcare is ensuring people have the ability to acquire appropriate, relevant, timely, and effective healthcare services, and that there are adequate sources of services and providers. In terms of measurement, healthcare accessibility is evaluated often and forever evolving to meet the needs of CAF members and their families. A study showed that access and availability to mental health services for serving military personnel with suicidal behavior is greater compared to the Canadian civilian population. Since a new model has been put in place, called the Primary Care Renewal, research shows that primary health care access is consistent with and in fact exceeds other primary health care practices across Canada by having better access to a range of comprehensive health services. These services include hospitalization and physician services, supplemental health benefits including drugs and healthcare practitioners, occupational health services, and dental services. 85% or more complete their non-urgent medical visits within 1 to 2 hours and report they are satisfied with the care they receive and the wait times for the clinical appointments. This is an important indicator to explore and understand, as the CAF members are not covered under the Canada Health Act, but rather they are under the responsibility of the federal government. There is a broad spectrum of healthcare access and availability to be understood. For example, there's a public service healthcare plan and a wide range of medical healthcare service available. Furthermore, accessibility to healthcare is crucial to ensure that CAF members are available for operations with optimal health fitness.
Health promotion. Definition. The Canadian Forces Morale and Welfare Services defines health promotion as the process of enabling people to increase control over and to improve their health. How it's measured. Canadian Forces Health and Physical Fitness Strategy and Canadian Forces Health and Fitness Program Delivery performed audits in 2009 and 2010. Audit objectives were to assess the strategy and program delivery, to make sure they were both appropriate and in place, to ensure clear objectives are in place, and to establish effective methods to track and monitor progress. Rationale. Health promotion programs are imperative to the Canadian Armed Forces. The main health promotion program is called Strengthening the Forces, henceforth referred to as STF. STF is geared towards promoting independence and autonomy regarding overall health. Health promotion programs in the Canadian Armed Forces aim to address the 4 areas of addictions awareness and prevention, injury prevention and active living, nutritional wellness, and social wellness. Personnel support programs, or PSP, are the ones that are in charge of the delivery of the health promotion programs in the Canadian Armed Forces. An example of a program would be the Butt Out program. This gives specific guidance to help Canadian Armed Forces members quit smoking, which includes counseling and access to smoking cessation products and medications. There is also a wide variety of mental health programs and services, which many are offered at no cost to the member or family members.
Health outcomes is defined as variations in the health of a population that are accredited to particular interventions. Outcomes are areas that gauge where improvements are required or if progressions have been made. Health outcomes are significant in the Canadian Armed Forces because good health outcomes allow members of the CAF to perform their duties. The rationale for choosing health outcomes as a quality indicator is that it is important to the CAF because it improves the health of that population and allows for reform based on the identification of amendments needed in that healthcare system. Measurement of health outcomes as a quality and performance indicator. The Health and Lifestyle Information Survey is a self-rated, paper-based survey that was issued to 4,312 randomly selected CAF members in 5-year intervals. The participants rated their health as either excellent, very good, fair, or poor in several categories, and the survey results were compared against the other years.
The fourth indicator we chose to evaluate the Canadian Forces Health Services Group was spending. So healthcare spending measures the consumption of services and goods related to health and wellness. Spending is typically measured in costs, such as dollars and percentages, and it's nice because we can compare it to the national averages, which illustrate civilian expenses. We had trouble finding recent figures. However, we did find a report from 2005-2006 that indicated the Canadian Forces Health Services Group spent approximately $8,600 per member, and this is in comparison to the national average, in which $4,500 was spent. So that would be on the average Canadian who's a civilian. We chose this particular indicator because, first, monitoring spending allows for budgeting and forecasting at a national level. Secondly, it lends to accountability of that particular jurisdiction, so a checks and balances system, helping decrease markup billing, discrepancies with invoice approval, inconsistent reporting of usages and fees, and post-payment verification costs. And lastly, tracking spending provides an opportunity for quality assurance. So if there's unclear definitions or limited monitoring or even insufficient guidance, that all affects the reporting numbers.
Client experience is defined as the client's various interactions with the healthcare system and whether their expectations were met. This quality and performance indicator was measured using the same health and lifestyle information survey that was used to measure the health outcomes indicator. Client experience is important as a quality and performance indicator because a positive healthcare experience increases the likelihood that the client will implement the medical advice given by a physician and adhere to treatment plans. It also leads to overall better health outcomes such as improved emotional health, resolution of pathological symptoms, increase in overall function, and control of pain levels. Additionally, evaluating client experience assists CAF Health Services in recognizing and understanding issues within the system. This information can be used to improve the quality of care and reduce the risk of malpractice.